My name is Professor Nikhil Pradhan, orthopedic consultant specializing in hip and knee surgery. I practice at Spire Cheshire Hospital. ROSA stands for Robotic Surgical Assistant. It essentially consists of two parts. The ROSA has a preoperative part and an intraoperative part. Preoperatively, we have either an X-ray or a CT scan of the patient. This allows us to do a 3D model of the knee. It allows us to assess the anatomy better. Where are the defects in the bone? Where are the osteophytes that need to be removed? We can then plan the surgery, plan the cuts, and precisely decide what is the exact size of the component that we need to use and where it needs to go. So in a sense, we can almost plan the whole surgery before we do the surgery. In theaters, we have the ROSA robotic arm on one side, and we have the monitors that monitor the sensor on the opposite side. I would use the robotic arm in theaters to do a digital map of the knee. That's a registration process. That registers an additional 3D model onto the platform. I can then compare what is preoperatively done to what I see during surgery. As I make the cuts, the robotic arm is guiding me all throughout and giving me a live feedback to say, are these cuts correct? Do I need to tweak them? Are there any changes to be made? And then once we've put a trial component in, I can accurately decide whether the knee is balanced, whether it functions correctly before I place the final component. So it is a way of getting real-time live feedback, which is completely new, and robotics allows us to do that. So post-surgery, the patient has a spinal anesthetic. So the patient has fantastic relief of pain and is pain-free. As soon as the spinal wears off, which could be at about 4 to 6 hours, we then mobilize the knee. We sometimes get the patient to stand up, to do some gentle exercises if possible. The following day, the patient then starts walking, does his exercises, and depending upon how well the patient is doing, the patient could be home on the day after surgery or maybe with a 2-night stay. Physiotherapy is absolutely crucial, and the patient will be taught physiotherapy exercises to do whilst in hospital, and this will continue post-operatively for about 6 weeks. Most patients use crutches. They'll use crutches for approximately 2 to 4 weeks depending upon how they feel, and once they are confident and the physiotherapist is happy, they can discard their crutches. We normally see patients in clinic at the end of 6 weeks, by which time they're quite independent and doing most of their activities. With the fact that we have done everything which is planned preoperatively on 3D scans, real-time surgery, it almost has an advantage of having enhanced recovery, which means that the function of the patient is quicker, their rehab is quicker, and it is akin to having minimal invasive surgery where we cut only what is required and we expose surgically only what is required.